Morning, folks. This is Don Graves, and welcome to this week's Wednesday webinar. I'd like to thank our sponsor, Retirement Funding Solutions, for sponsoring this. We've got Dan McGrath, who's going to be speaking to us about what you don't know about retirement will hurt you, particularly planning for healthcare. Dan has been doing this for a long time. He's an author of a book you can find on Amazon, and it's going to be an exciting time here with Dan. So I'm going to turn it over to Dan. And if you've got questions, I'll moderate the questions here where I'm circling. You type in your questions, and then I'll feed them to Dan as we get to that point near the end. Dan McGrath, take it away.
Thank you very much, Don. I want to thank everybody for taking time out of their day to hear what we have to say about healthcare costs, about what people don't know about retirement and how they're going to hurt them. It's basically all based on retirement. A little bit background of who we are at Jester Financial Technologies. We are a fintech company, ultimately financial software. We don't carry any licenses. We do not sell any product. Ultimately, what we believe is very simple. We believe that healthcare is going to fundamentally change the financial industry. What we've done is created software that allows the financial professional to monetize the conversation around healthcare and also Medicare, while also making sure that they remain prudent with any rule or regulation that may come about. We do understand that there was this thing called the fiduciary rule through the Department of Labor that has been thankfully brushed to the side, but we do know that there are other states like Massachusetts and California that are creating or thinking about creating their own. What we've once again done is designed some software that will show the financial industry how to get around the DOL without a problem, or how to get around the fiduciary rule. What you're looking at here is the beginning of the slide deck. The reason why we're using the T. Rowe Price slide deck is this is our slide deck. We use it for, when speaking for T. Rowe Price, we are hired by them to speak to independent advisors as well as investors to give them information based on healthcare. The reason why we're using it today is very simple, is it brings credibility to the information that we're given. In order for us to present, it has to be compliant. So this will hopefully give a little bit more of credibility on what we're doing and a little bit more, how do I want to put it, put you more at ease on the information that we're going to be providing. When we're talking about healthcare, or ultimately what we want to do when we're talking about healthcare, is we want to discuss how healthcare is going to impact the overall financial plan. And what we also want to do today is show you how certain strategies can be implemented today that are going to make pretty much every single person that you meet from this point on a potential client if you want them to be a client. And then finally, what we're going to do is give you a couple scenarios or a couple ideas that you can take away that you can implement today that is going to make you stand out or you be a little bit different from everybody else that you're competing against, especially when it comes to healthcare. So when we start talking about healthcare, the first thing that we need to talk about is where healthcare is in the minds of those heading towards retirement. And what we're finding out, as you can see from the slides, is every single survey is starting to dictate that healthcare is becoming the largest expense, or the biggest concern that people have. Now, when surveys come out, we are contacted because we're considered to be one of the foremost leaders on the subject. We've been doing this for well over a decade. We were contacted by USA Today. USA Today asked us a very simple question. Why is healthcare becoming such a large concern? And our reply was very simple. It's a question that we like to give, and we like to give to every single financial advisor and pretty much every single financial professional. And the question that we gave USA Today was very simple. There's a specific reason why healthcare is becoming a major concern, and here's the question. Can anyone please name the financial firm that is helping people plan for healthcare? Now, believe it or not, there isn't one. Currently today, there is no financial firm that is helping people plan for healthcare. The reason why healthcare is becoming such a major concern is because for the first time in the baby boomers generation or baby boomers experience, the financial industry has gone dark. If you look at it this way, when the baby boomers were planning for retirement or wanted to start planning for retirement 20, 30 years ago, the financial industry met their needs by creating 401k plans, IRAs, TOs, SEPs. When they wanted to plan to send their children to college, the financial industry also met that demand by creating 529 plans cover deals. They want to transfer assets to their beneficiaries, to their children. We created wills and trusts. Well, now the baby boomers are heading towards retirement, and they're heading towards the use of healthcare and using the U.S. healthcare system. And where is the financial industry? Currently, there isn't one company helping people plan for healthcare. There are individuals doing amazing work, and they should be commended. But unfortunately, there are no firms actually helping anyone plan. Now, the reason why healthcare needs to be planned for is very simple. If you take a look at the chart, we know that healthcare, according to Credit Suisse Euromonitor, healthcare is becoming the largest expense that Americans that are 60 and older have. As you can see from this graph, or this pie chart in dark blue, healthcare makes up a third of all expenses. It's larger than any two expenses provided combined. Now, Credit Suisse couldn't believe this number, and they couldn't believe the percentage. We were contacted a few years ago when this came out, and they said, how is this humanly possible? And we said, it's very simple. Healthcare is not the most expensive cost for an American that's 60 years old, not even remotely close. But if we have a conversation with a 74, 75-year-old woman who's had a slip and fall, maybe broke her hip or broke her shoulder, what's her only expense? How about a conversation with an 82, 83-year-old man with dementia? What's his family's expense? Ultimately, healthcare becomes the largest expense simply for the fact that you can't downsize it, you can't skip it, you can't sell it off, and you can't avoid it. As you get older, you're going to have healthcare. You're going to use it. The reason why healthcare becomes the biggest or the most expensive expense we have is it ultimately is the most used as we age. Now, we take a look at the opportunity on who has healthcare costs and how you can help them plan for it. Well, we know, according to Nationwide, 97% of Americans that are 65 and older who are no longer covered by credible health insurance through an employer or spousal employer, meaning they're retired, they're 65 and older, they enroll in a Medicare. When Nationwide found out this information, we were contacted years ago, and they were asked a very simple question. How is this humanly possible? How do we get 97% of Americans to do something? We have tax season yesterday. We didn't get 97% of Americans to file taxes. How did we get 97% of Americans to enroll in a Medicare? Well, we made it simple. Take a look at the next slide. It's mandatory. Believe it or not, through federal law, in order for you to receive your Social Security benefit, you must accept Medicare when eligible. If you do not accept Medicare when eligible, meaning you're 65 and older, no longer covered by credible health insurance through an employer or spousal employer, you forfeit all current, future, and any received Social Security benefits. You have no choice. In order for you to receive your Social Security check, you must accept Medicare. On top of that, the Affordable Care Act has a stipulation in it that makes it mandatory that you have health insurance. Today, the current administration has waived the penalty that there is no fine for you not having insurance, but the law is still on the books. All it's going to take is the next administration to implement another fine. So on the books, believe it or not, there is a law through the Affordable Care Act stating that you have to have health care. There's just no penalty as of yet. The penalty could be coming. On top of having to have Medicare in order to receive Social Security, and on top of the Affordable Care Act stating that you have to have health insurance, Medicare has other parts, Medicare Part B, which covers medicalization or covers doctor visits, and Part D, which covers prescription drugs. They come with late enrollment penalties that if you do not enroll in a Medicare when eligible, these late enrollment penalties are assessed. The issue with these penalties are that they're compounding, meaning the longer you delay, the bigger the penalty gets. And then they're perpetual, meaning once you do accept Medicare, they stay with you for the rest of your life. On top of that, if you do not have health insurance through an employer, spousal employer, and you do not have health insurance through Medicare, and you don't have any health insurance, period, unfortunately, you can't access the U.S. healthcare system. Yes, the U.S. healthcare system will accept you in case of an emergency, but once you are stabilized, you'll be discharged because you don't have any health insurance. On top of that, anybody that happens to have long-term care, you've just negated the ability to get into a facility if you do not have if you do not have health insurance, either through an employer or through Medicare. So let's look at healthcare this way. We know it's the biggest concern, we know it's the largest expense, and we know it's mandatory. The question that you should be asking yourself is, which financial firm is helping people plan for it? For financial professionals that understand these rules and regulations, here is an opportunity unlike any other. There is no competition. You're not competing against Morgan. You're not competing against Merrill. There's no Wells Fargo. There's no TD. There is no financial firm helping people plan for this. So advisors that understand this information, when asked, what do they do? Very simple. I help people plan for the only mandatory cost in retirement. The reply is usually, what do you mean? The simple reply by the financial professional, you mean your financial advisor hasn't spoken to you about the regulations around healthcare? How about I come by your office at 10 o'clock on Tuesday and we can go over what your financial advisor hasn't discussed? And here's the beauty of an opportunity. We know, according to Sun Life, NPR nationwide, less than 8% of the U.S. population has factored in healthcare costs into any financial plan. Now, we at Jester Financial Technologies know that this number is kind of low. We also know that many people have financial planning software that allows them to put in healthcare costs, and they get to show the projected rate. Even with that information and the financial planning software, we at Jester Financial Technologies will tell you it's not really 8%, it's even lower, it's about 1%. The opportunity for an advisor that understands the rules and regulations around healthcare, you can speak to any single person. The reason why we can say that? Very simple. We know what the rates are. We know what the costs are. What we do at Jester Financial Technologies is we contact every single health insurance provider in each state. We break down the data by age, by gender, by residency, and we blend tobacco use. So we know what the costs are. We know that Part B, it's through the federal government, it's $134. We know Part D, prescription drug coverage, on a national average, it's $52.52 a month. For supplemental, a Medigap plan, we use a Plan F policy. We know that on average it's $208.18 a month. Can a person get cheaper insurance? Of course. But that's not the job of the financial industry. The job of a financial professional is to make sure that the financial plan can sustain the average costs of an expense. It is not their job to go out and get cheaper insurance or better insurance. It's just to be able to sustain the cost that is associated to healthcare. Now, we do leave Part C open. The reason why we use Part C open, that's what is known as a Medicare Advantage plan. The reason why we ask the industry not to plan for Medicare Advantage plans, even though they're great plans, they're absolutely fantastic, the issue with the Medicare Advantage plan is you can pick or select very unique coverage for the individual. So you can have certain things covered that other people don't have or don't necessarily need. Because of that, you open yourself up to unlimited liability. Once you start planning for specific disease states in retirement, have it be anything from prescription glasses to cancer, you've now opened an unlimited liability upon yourself. Because all a regulator has to ask is, well, you plan for my client's cost in podiatry, or you plan for my client's cancer, or you plan for my client's needing of prescription eyeglasses. So you're a healthcare expert. Why didn't you plan for my client's dementia? So ultimately, we don't ask the financial industry to plan for outside unknown costs. We plan for what we know. And we know what original Medicare is. Part A, Part B, prescription drug plan, and then a Medigap plan that fills in all the gaps that are led by or that are created by original Medicare. Covers all the excess charges, deductibles, and any copays and fees for Part A and Part B. So we know the average annual cost for a couple in 2018 is $9,400. What we also know is what Medicare tells us, what the average inflation rates have been. We know 3, 5, 10, 20 year, as you can see from the chart. We at Jester Financial Technologies provide this chart to our advisors for the simple reason. The days of you putting in your own inflation rate into your own financial plan when it comes to healthcare is over. Once you place a number in as an inflation rate, let's say you use 3%, you use 4%, all it's going to take is one regulator to ask, where did you get that inflation rate? It has to be sourced. There's no longer the time of I just picked it out of a hat, because if you did, you're now a healthcare professional. So we give you what the information is based on Medicare. But what's even better about Medicare is we know what the average rate of inflation has been historically. As you can see from this slide, it's 7.73%. And we actually know what the future is. Believe it or not, the Medicare Board of Trustees report every June comes out, and Medicare tells us what the expected projected rate of inflation is going to be. From 2019 to 2026, according to the June 2017 Medicare Board of Trustees report, Medicare is going to inflate at a rate of 5.89% in that given time frame. So we know what those costs are, and we know what the inflation rate is. So we know that a 60-year-old couple that wants to retire at the age of 66, that happens to live in, let's say, Idaho, and they want to plan to the age of 85, we know the costs are going to be $485,000. It's an Excel spreadsheet. We know what the Medicare costs are today, and we know what the inflation rate is going to be tomorrow. We're given the Medicare rates by not only the federal government, but by the private health insurance companies that administer the programs, and we're given the inflation rate by the federal government. We know what the costs are. Now, the reason why we can say no one's planning for this is very simple. We know that Medicare is also means tested. Through the Medicare Modernization Act of 2003, Medicare created what is known as the Income-Related Monthly Adjustment Amount, that are known as IRMAA. Ultimately, what Medicare does is they're going to look at your client's income in retirement. If your clients happen to be generating too much income, they're going to pay more for their healthcare costs. Healthcare coverage and healthcare costs are no longer about access of care or even health or medical history. It's now based on, when you're retired and under Medicare, how much income you're generating. So the question that we like to ask is very simple. The financial planning software that is currently on the desktops of the financial professionals throughout the United States, does this financial software adjust healthcare costs as income goes up? Well, if it doesn't adhere to federal law. So we know that no one's planning for this. The opportunity is unlimited. When an advisor is asked what they do for a living, if they understand these regulations, the advisor can simply state, I help people plan for their only mandatory cost in retirement. Do you realize that you have to have health care? Do you realize that it's predicated on the amount of income you generate? And oh, by the way, do you know, in the next slide, do you know what income is? And we know the federal government has defined income as your adjusted gross income plus any tax-exempt interest, or everything on lines 37 and 8B of the IRS Form 1040. That's according to obamacarefacts.com, as well as the IRS.com, as well as socialsecurity.gov. So some examples that we give. 100% of your Social Security, all wages, all tips, capital gains, with the exception of the sale of your primary residency. If the gain is under $250,000 as an individual or under $500,000 as a couple. All dividends, including those from municipalities. If we look on the other side of the column, here's what's key. Any distribution from any qualified tax-deferred investment vehicle. Now, we talked a little bit about healthcare and how healthcare can help you maneuver around the fiduciary rule if it does happen. Well, let's look at the reality. The 401k, the traditional 401k, a traditional IRA, which are known as retirement assets, when a person reaches the age of 70, it's going to generate a required minimum distribution, an RMD. This RMD is going to count as income. The RMD, coupled with the person's Social Security check, is going to count as income towards their health care. What's going to happen to the majority of Americans that have saved money in their traditional 401k or traditional IRA? Well, their health care costs are going to skyrocket. Now, the federal government has created or tried to create a rule or regulation that states if you handle these retirement assets, you have to do what's prudent. Well, here's the argument. If you do not handle those retirement assets, did you do what's prudent? Your client's health care costs are going to skyrocket. The reason why these assets must be changed or must be converged, we'll get to the solution in a couple more slides, is it's about controlling your client's only mandatory costs in retirement. That traditional 401k, that traditional IRA is going to be held against you when your health is on the line, and it's going to generate an income coupled with your Social Security check, and it's going to increase your only mandatory cost in retirement. Now, thankfully, the federal government has kept the numbers kind of high on who's going to be impacted by this. And as you can see from the brackets on the screen, in 2018, individuals earning $85,000 or less, or couples earning under $170,000 and less are not going to be impacted by Medicare's IRMAA. But anybody that happens to earn $1 too much, well, they're going to pay 40% more. As you can see, the Medicare Part B premium for the first bracket is $187.50. And you can see that the brackets continue to go up until the client hits, or until the person's paying 220% more for their Medicare because of income, if they're earning over $160,000 as an individual or under $320,000 as a couple. Or, I'm sorry, over $320,000 as a couple. Now, who is this going to impact? Well, we at Jester Financial Technologies like to tell people in a very sarcastic way that this isn't going to impact many people. It's only going to impact those that the federal government deemed to be extremely affluent. So let's do the math. We know, because we know what the required minimum distributions are going to be, and we know what Social Security benefits are going to be based on wage and income. We know what people are going to generate throughout the course of their retirement. So believe it or not, this is only going to impact those that happen to be currently right now 60 years old today. They want to retire at the age of 70. They're placing $9,000 a year into their traditional 401k. That's including the company match. They get a 6% rate of return. They earn $75,000 a year, and they already saved $100,000 in their 401k. We know, because of the growth in the traditional 401k and what their Social Security benefit's going to be when they retire, we know what their income's going to be, and we know what the income's going to grow at. We'll get to the cost of living adjustment for Social Security in a moment. We know by the time they reach 84, they're going to be in the first bracket. We know if they happen to be part of the 1% wealthiest people in the world and they have $500,000 in their 401k, we know they hit the first bracket instantly. We know they hit the second bracket by the time they're 75, and they go into the third bracket 133 to 160 or 266 to 320. They go into the third bracket at the age of 82 and stay there for the remainder of their life. Now, is it that big of a deal? Well, we don't know. But what we'd like to show people is what the projected costs are going to be. We know if we take a 50-year-old couple, want to retire at the age of 66, living to the age of 85, we know what their Medicare premiums are going to be if inflation stays the same. The question that we like to ask people about healthcare inflation is very simple. We have 76 million baby boomers heading towards retirement. They're going to start accessing the U.S. healthcare system, plus taking Medicare benefits. Is the inflation rate going to go down, or is it going to go up? Regardless of the answer, let's remain Medicare being at 5.78%. We know that Medicare premiums are going to be $802,000. If they happen to earn $1 too much throughout retirement, that same couple is going to give the federal government an extra $150 grand for health care benefits, and they're going to receive no other added benefit. They're just going to pay more just because they've earned more. And if they happen to hit the highest income bracket, well, they're going to give the federal government an extra $1 million, all because they didn't plan accordingly. Now, where are we headed with this? Well, unfortunately, through the Tax Jobs Act, when you're going to find out if we're heading any place different, you're going to realize that we're not. What you're looking at here today are two different things on one slide. You're looking at what the IRMAA brackets are going to be in 2019, according to the Tax Jobs Act through the Medicare Board of Trustees. You're going to notice at the bottom that the federal government has created a new bracket. On top of them creating a new bracket, they're going to create another new penalty as well. That's starting next year in 2019. The other reason why we like to give this slide is because it's also giving you what the fees are going to be in 2026. Now, you're going to notice that I told you, or it was explained, that the Medicare Part B surcharge in 2018 is $187.50. As you're going to see on this slide from the Medicare Board of Trustees, come 2026, the same surcharge is $266 a month. In order to receive that growth in this period of time, Medicare has to inflate by a minimum of 5.1%. For those looking at prescription drug coverage, all the way over onto the right, in order to go from 1320 to 2110, that's an inflation rate of 6%. The federal government is not hiding the fact that health care is inflating at more than 5%. They're also not hiding the fact that your health care is based on the amount of income that you generate, that income is practically everything in your financial plan, and that these costs are mandatory. On top of that, we know, because of the Tax Jobs Cut Act, we know that the Medicare IRMAA brackets, starting in a decade from this year, in 10 years, these brackets are going to change on an annual basis. They are going to be based on what is known as the Consumer Price Index for urban consumers. And if inflation goes up, then the brackets will go up. If inflation goes down, well, then the brackets will go down. But between now, 2018 through 2028, the brackets will not adjust up for inflation. They are to remain at least constant through 2028. They may even possibly go down, but they will not be adjusted up until 2028. And then once they are adjusted up, or when they are adjusted in 2028, they're going to change on an annual basis. For advisors understanding this information, it creates a wonderful opportunity. Mr. and Mrs. Client, do you know that you have a mandatory expense? Do you know that it's predicated on income? Do you know that the income levels are going to change on an annual basis, or could possibly change on an annual basis? You have to now meet with your clients on an annual basis to make sure that they are not impacted by Medicare's IRMAA. For those financial advisors that may be competing with a robo-advisor from a firm like Merrill Lynch or Morgan Stanley, do the robo-advisors provide this information? We will argue they don't. The opportunity that you have is endless. Now, when we talk about healthcare and we talk about all these large costs, we also want to make sure that you and your clients understand that there's really not that much to worry about. You have nothing to worry about when it comes to these costs because all these costs are already taken care of. They're already paid for. They don't have anything to worry about. Now, the reason why we can say that is very simple. We know that in order for you to receive your Social Security check, you must enroll into Medicare. Well, how do you think you pay for your Medicare premiums? Well, because of a law going back to 1984, we know that your Medicare premiums, at least the bulk of them, are taken directly out of your Social Security check. So the question that we like to ask at Jester Financial Technologies all the time is, what's going to happen to your Social Security check? We know that Medicare is inflating at 5.78%, best rate scenario, but we also know, if you look at the slide, is that the Social Security cost of living adjustment for the foreseeable future, according to the Social Security Board of Trustees, the link is right there and below, the cost of living adjustment is going to be no higher than 2.6%. So here's the question that we like to ask. If we know one thing, which is Medicare, is inflating at twice as much as the other thing, which is Social Security, how long does it take the one thing, Medicare, to catch up to Social Security? Medicare is inflating at 5.78%. Social Security at best is going to inflate at 2.6%. We know your Medicare premiums come out of your Social Security check. What's going to happen to everyone's Social Security benefit? By the way, here's the other question. The financial planning software that sits upon financial advisors' desktops, it shows Social Security income, but does it show Medicare costs coming out of Social Security income? Or more to the point, does it follow federal law? How many people are planning for this? The opportunity is unlimited. Thankfully, no one's Social Security check can go down. Because believe it or not, back in 1984, the federal government created what is known as the Hold Harmless Act. And as you can see from the slide, the Hold Harmless Act basically states that no one's Social Security benefit can be decreased by Medicare Part B premium increases. So as long as your Social Security check, however it may work, your Social Security check will never go down because of Medicare Part B increases. So the example that we like to give is what's happened over the course of the last 4 years. As you can see from this slide, in 2015, Medicare was $104.90 a month, Medicare Part B. In 2016, Medicare Part B only inflated by 16%. It went to $121.80. The same year, Social Security didn't give a cost of living adjustment, so no one received any money. Everyone was held harmless because no one's Social Security check could go down. So everyone's Medicare premium stayed at $104.90, even though it was supposed to be $121.80 for those that were collecting Social Security. 2016 to 2017, Medicare only inflated by 10%. The same year, Social Security gave a 0.3% COLA, or $5 on average, to every Social Security recipient. Well, since the $5 wasn't enough to meet the Medicare premium increases, their Medicare premium went to $104.90, from $104.90 to $109.90, and everyone's Social Security benefits stayed exactly the same. In 2018, thankfully, thankfully Medicare didn't increase their Part B premiums, while Social Security gave a 2% COLA, or roughly $27.38 extra to the average Social Security beneficiary. But the Medicare premiums are still $134. Your clients owed the difference. So what did they really receive in a Social Security benefit? On average, they received $3.28. To show you how this is going to happen, or what is happening to your clients, we take a person that happens to be earning $75,000 a year. They're 60 years old today. They want to retire at the age of 66. Social Security's quick calculator tells us that their Social Security income is going to be $28,000. We're going to inflate that at 2.6%. We're then going to take a look at what their Medicare costs are going to be, including a Medigap plan. We're going to inflate that at 5.78%. We know what their take-home Social Security benefit's going to be, which is the gray line. As you're going to see, once health care is applied to Social Security, no one's Social Security benefit's going to increase. The sales idea to a client is now we can't rely on Social Security to keep up with inflation because you have to pay for health care. Health care is inflating at over 5%. Inflation may only be at 2 or 3%. We need to generate another form of income that can help you offset this loss of Social Security income. This gives you the wonderful opportunity of being able to discuss stocks that generate a high dividend, mutual funds that have a high dividend, the opportunity to discuss an annuity, have it be fixed or have it be variable. Anything that can generate an income a client must take. When we talk about high net worth clients, things are a little bit different. We know for a client that once again is 60 years old, wants to retire at 66, if they happen to be earning the Social Security maximum, we know that their Social Security benefit when they retire is going to be about $41,000. We're going to inflate that at 2.6%. Now let's say they happen to be in the highest Medicare IRMAA bracket. We're going to inflate that at 5.78%. We know what their Medicare costs are going to be. Now, we've stated that no one's Social Security check can be decreased by Medicare Part B premiums. Well, the reality is we lied. The reality is, in 2009, Congress went ahead and changed the Hold Harmless Act to state that those that enter Medicare's IRMAA are no longer going to be afforded the protection of Medicare's Hold Harmless Act. So as you can see from this slide and this line, this graph, in gray, you're going to notice Social Security income, the realized, going below zero. So believe it or not, you're going to experience clients that are going to enroll into Social Security. They're going to accept Medicare. They're going to find out that their Social Security check, due to improper planning, isn't covering the high cost of their Medicare premiums. They're going to then write a check to the federal government for what their Social Security check didn't cover for their Medicare premiums. And here's the cherry on top. They are then going to be taxed on the very same Social Security income they never received. The question that we like to ask at Jester Financial Technologies is, which financial firm is helping people plan for this? You have 76 million people heading towards retirement. They all have one thing in common. They have a mandatory expense. It's predicated on the amount of income they generate. Income happens to be not only their Social Security check, wages, any tips, any interest, but also happens to be that tax-deferred 401k traditional IRA. Their very own savings for retirement are going to be held against them to drive up their health care costs. As their health care costs increase, their Social Security check is going to be consumed, all because of their savings. And we know less than 8% of the U.S. population has factored in any of these costs. What is your opportunity? We argue it's endless. And when we start talking about an endless opportunity, we have to talk about the solutions. The solutions that we provide don't count as income. We know that health savings accounts, or HSAs, do not count as income. They're wonderful vehicles. Any client that has access to an HSA should be investing as much as they possibly can up to the maximum limit, and they should leave it there to let it grow. The issue with the health savings accounts, very simple. You're limited in how much you can put into them. The other issue is only those that have access to a high deductible health plan can use them. But once again, once you have money in an HSA, you can allow those to grow. That money needs to be managed. On top of them growing, if you, your spouse, or any dependent of yours has a health-related need, you could take money out of an HSA, and the HSA is tax-free. The 401h, which I'm willing to bet many of you have already heard about. We don't like to talk about these in depth because they're used often. But the 401h, created in 1984, is an HSA on steroids. You can put an unlimited amount of money into a 401h. It grows tax deferred. If you take it out for any health qualifying benefit for you, your spouse, or any dependent, they're tax free. They're piggybacked to a cash balance plan or a money purchase plan through a corporation or a company's retirement plan. So you have to open up a cash balance money purchase plan, piggyback the 401h. Take the assets, move them over into the 401h. This lies the rub with the 401h. The problem with the 401h is twofold. One, the first one is they are participating, meaning everyone that's part of this corporate retirement plan for the 401h has to always be part of the company's retirement plan, meaning they can never actually retire from the company. So 401h plans don't work for large corporations, but they work very well for small mom and pops. They work very well for sole proprietors. The other issue with the 401h is they're non-discriminatory, meaning if one person that's part of the plan wants to put 25% of their assets into the 401h, everyone has to put the same percentage of their retirement assets into the 401h. Again, doesn't work for a large corporation, works for a small mom and pop. Here's your sales idea when you're talking to a small law firm, small accounting firm, small insurance agency. Have your parents plan for long-term care. If they say no, here's an opportunity to take corporate assets, move them into the 401h. When your parents become a dependent of yours, all they have to do is be indigent and only be receiving Social Security income. They become your beneficiary. You can use 401h assets to offset their long-term care. And you can put an unlimited amount of money into it. We'll talk a little bit more in depth with Roths, but the most important thing we want to talk about is home equity. Home equity does not count in any way, shape, or form as income. Home equity must be discussed by the financial industry for the simple fact that people are sitting on a couple $1 trillion in assets that they can use to help offset healthcare costs. The reason why home equity becomes so important is very simple, and it's a question that we wrote an article about that is on CNBC, and the question is very simple. How many people believe they're going to go into a nursing home? And here's the answer. None of you. We at Jester Financial Technologies, you can find the article on CNBC, are going to tell you none of you are going into a long-term care facility. The reason why we can say that is very simple. We know the numbers. We know, according to the CDC and according to the Kaiser Family Foundation, we know that there are 15,642 long-term care facilities in the United States as of 2012. We know out of those 15,642 long-term care facilities in the United States, there are 1.61 million beds. Out of the 1.61 million beds, we know in 2012, 1.33 million of those beds were occupied. There are less than 280,000 beds in the United States available today for long-term care. We also know through the Department of Health and Human Services, better known directly from a gentleman by the name of Hunter McKay, who works at the Department of Health and Human Services and runs healthcare.gov, we know that 70% of baby boomers are going to need some form of long-term care. That's 54 million people. Out of the 54 million people, we are told by the Department of Health and Human Services, 25% of them are going to need to stay in a long-term care facility. That's about 12 million people. Where are 12 million people going to fit into 1.61 million beds? The harsh reality is people are going to have to convalesce as they get older at their homes. Where are they going to get the assets to convert their houses? Are they pull them directly out of their traditional 401k? That's what the financial industry's answer is. And what's going to happen? going to trigger a large amount of income coming out coupled with their Social Security check, and their health care costs are going to skyrocket. As their health care costs skyrocket, their Social Security dwindles. Now you have a death spiral because they have to take more money out of their traditional 401k. The beauty is you want to convert your home, take out the home equity. Pay for the chair lifts that you're going to need. Pay for the adult proofing of the bathroom. Widen the hallways to accommodate a wheelchair or a walker. When you go home tonight, look at how high your cabinets are. Can you reach them today? Will you be able to reach them when you're 85, 90 years old? America needs to wake up and realize that we have an aging population, 76 million people, heading towards retirement, sitting on trillions of dollars in home equity. They're going to be convalescing and spending the final days of their life in their homes. Their homes have to meet their needs. Where are they going to get the assets? Where are they going to get the money, the revenue, to pay for the changes? In order to control your health care costs, in order to save your Social Security benefit, the greatest option you could possibly pick, a reverse mortgage. This is federal law. That's the beauty. So if you take a look, next solution, life insurance. Life insurance for those that aren't sick, that aren't 45, 50 years old, that don't have access to a reverse mortgage, that don't have access to, or the time frame for annuity doesn't fit. Life insurance is beautiful for anybody that's 45 and younger. Why are you placing money in the traditional 401k? We know that traditional 401k is going to be used against you when your health is on the line. You're going to have a distribution from your RMD, counted as income, coupled with your Social Security check. Your health care costs are going to skyrocket by law, and it's going to consume your Social Security check by law. Well, why don't you save your Social Security check and control your health costs? You can buy a life insurance policy. We know that life insurance, the premiums can be paid over a 10, 15, 20-year period. They can have guarantees. They can give you a specific amount of money at a specific period in time in your life. Plus, you can also get a long-term care coverage rider on it. And the beauty is the cash value with inside life insurance doesn't count as income. When we talk about specific annuities, for anybody looking at the chart, specific annuities are the non-qualified annuities. We know that non-qualified annuities that are annuitized generate what is known as a tax exclusion ratio. Tax exclusion ratio, depending on the time that was invested and the life expectancy of the annuitant, or annuity, I always get those two confused, can be as high as, well, it can be as low as 20% or as high as 70, 80%. Here's a way for a client to take non-qualified assets, place it into a vehicle that's going to help them generate income, to help them offset the loss of Social Security benefits that they are going to receive, that isn't going to count as income. It's one of the better solutions. If we want to take a look at the best solution, very simple. Roth 401k, Roth IRA. We know that currently under law, the Roth provision doesn't create an RMD. If you do take income out of the Roth, it doesn't show up on your tax return. It doesn't show up on line 37 or 8B of the IRS Form 1040. Conversation with your client is very simple. Why are you placing money in a traditional 401k? You should be placing money into the Roth. If they don't have access to the Roth, is it possible that I can speak to your head of HR or your director of retirement? For your clients that are sitting on assets in a traditional IRA that they don't need, here's an opportunity to have a conversation about a conversion. That IRA is just going to kick off an RMD, increase healthcare costs, lower Social Security. You may want to take a look at a Roth conversion. We don't have to convert all the assets at once. We can do it over a 5, 10, 15-year plan. We also don't even have to do all assets. Once converted, we know that we're going to have to generate another form of income to help you offset Social Security losses due to Medicare premiums. How would you like to have a form of guaranteed income for the rest of your life? Through an annuity and a Roth provision. We've talked about life insurance and once again the 401h plan for sole proprietors. As we've stated, when you take a look at healthcare, there is a call to action. We know every single person has 4 things in common: mandatory expense in retirement, predicated on the amount of income that they generate. Income happens to be their financial plan, comes directly out of their Social Security check. In order for you to help your clients control their retirement assets, the traditional 401k that happens to be at Fidelity, if it is left there, it is going to kick off an RMD. It's going to increase your health care costs. It's going to lower your Social Security benefit. It may even completely consume it. In order to control that cost and save your Social Security check, we must convert that asset. We must take that asset out of Fidelity, convert it into a Roth. Once it's converted, we still have to generate another form of income, because no matter what we do, Medicare premiums are still coming out of your Social Security check. We need to invest that into something that generates another income. Because of healthcare, whatever regulatory rule comes around based on retirement assets, it is still negated, because you have to move retirement assets in order to control healthcare costs and save someone's Social Security benefit. An advisor that understands this information and unlimited access to every single person they meet, because how we like to end every presentation is very simple. How many people or which financial firm is helping people plan for this? It's unlimited. So with that, we'd like to thank you for your time. If there's any questions, we'd gladly be able to answer them. We do apologize for going a little bit longer, but we want a little bit in depth.
Fantastic. We've got some questions here, Dan, and I'm going to load them up on the board. So if you're listening and you've got some questions, type them in. They'll take a second to get to me, and then I'll read them and I'll let Dan reply. So let's start back from earlier. Sandy says, unfortunately, I know seniors who never enrolled in Medicare, and now 5 years later, penalties would be too high. And I think she was responding to the issue of your statement that if you don't enroll, that penalty will continue with you. Would you add anything to her comment, Dan?
No, they're looking at, for somebody that's delayed for 5 years, they're looking at a 50% more surcharge on Part B and a 60% higher surcharge on Part D. If there's a lot of ways, if Sandy'd like to contact us, we might be able to figure out a way. Maybe they've had credible health insurance through an employer. Maybe they didn't know. Maybe they have they're veterans and they have access to health care that way. Maybe we can get the penalty knocked down. There's always ways around it. But she's 100% correct. The penalty is going to be massive.
Aaron asked, money from a Roth is not counted as income with respect to Medicare? Question mark?
Yes, it is not. So currently, the way the law is written is Roth, any distribution from a Roth does not show up on line 37 or 8B of the IRS Form 1040. So it does not count. That's why we at Jester Financial Technologies have written ad nauseum that the only type of investment you should be making is a Roth investment. Pay the taxes today. The other argument that we make, and we'll gladly show to anyone, there is no tax bracket that you can currently be in today that is going to save you more in taxes today by getting the tax break today through a traditional investment. It's going to save you more than what you're going to spend in healthcare costs and loss of Social Security later. The latest bracket that's just been created, by the time the people that are in that bracket reach that bracket, by the time they're, I believe it's 78, they will have lost more than 120% of their Social Security benefit year over year. So the Roth provision is the only way to go.
Next question, comment. Slide 17 asks the question, is that 2019 and 2026 or 2019 through 2026?
No, it's both. So we tried to fit 2 slides into one. So the first slide, so that is going to, what is going to happen, the brackets are in 2029. So I'm sorry, in 2019. So there will be a fifth bracket in 2019. So next year, there's going to be a fifth penalty bracket. The costs that we put on that bracket, that's 2026, according to the Medicare Board of Trustees. I apologize for not being more clear on that.
David asked, can we get a copy of the slides?
Of course. All we need is an email. We'll gladly send it to you. I don't know if you've provided our contact information, but we'll gladly.
There'll be an email that goes out after this to the listeners of this and the recording, and I'll include your contact information.
Yeah.
Dan.
So not only do we provide the slides, but we provide any marketing data that we've created. Not data, but marketing tools that we've dated or information that we've created. We're just trying to get as much information out as humanly possible to the advisor.
Great. Slide 31 says, person asks, with the 401h, can you have individual/solo 401h for a self-employed, no employees person?
That is exactly what it's created for. So, yes, we are not the administrator. For someone that wants to set this up, you're going to have to find a third-party administrator that is, what's the one I'm looking for, is educated in the 401h. Unfortunately, we've only found one that we vetted and worked with. We, once again, do not have any licenses. We do not sell product. We are not in competition. All we do is provide data. What we can do is introduce anybody to the gentleman or the law firm that is the TPA administrator of 401hs. They are Fox, Hall, and Lalonde. They're out of Fort Wayne, Indiana, and they will gladly help you and give you as much information as possible. And they are perfect for sole proprietors.
Dan, it's 2 o'clock. We started at about 2:04, so I'm going to take about 4 or 5 more questions till we go to 5
Sure.
after, folks. And Fred had 3 questions in a row. So Fred, I'm going to try to summarize these questions. Is there a book that you can recommend explaining all these concepts? And then he also asked, are you talking about whole life insurance or IUL? What about asset-based long-term care insurance?
So there is a book. I'm going to plug my own, and that's not the need. That wasn't the point here. Obviously, our book, What You Don't Know About Retirement Will Hurt You, has all this information. It's a little bit older. We have to update it. We'll gladly send you out any of the pieces that you need, but there is also a book, and I think I make like 32 cents on each book. So we're not necessarily pushing that, but we'd love to have you read the information, so we'll get you the information if you need. Yes, when we talk about life insurance, we are specifically talking about cash value life insurance. So we're looking at whole life or IULs. We understand that a VUL will work well, but it may be, a VUL may be too, volatile for people. And a UL, the cash value, may run out sooner than needed. But we are talking specifically, yes, whole life, index universal life. We're big proponents on everyone having to do that. Maxing out life insurance is an incredible solution, especially if you're young enough. And then obviously a long-term care. We encourage everyone to own long-term care, specifically if they can own the Cadillac of long-term care. Have that be an individual policy, a standalone policy through firms like John Hancock or Mutual of Omaha. But not everyone can afford them, and the premiums can change. So what we're advocating for is wonderful products like Pac Life's Premier Care or Lincoln Financial's Money Guard. If people don't want to go that route, there's nothing stopping anyone from opening up an account and just earmarking it long-term care expenses and funding that with mutual funds, funding that with an annuity, whatever it may be. We're just trying to get anyone and everyone to start planning for long-term care. And another great product as well, my little plug, is One America.
So final questions here. I'm going to, folks, if you're listening, I'm going to send an email to those who registered and those who are listening that I'll give Dan's information. And Sandy said, can you repeat the TPA name?
Fox, F-O-X, Holland, H-O-L-L-A-N-D, Lalonde, L-A-L-O-N-D-E. The person at that administration law firm that does the work is John Lalonde. the third person. Fort Wayne, Indiana.
Question came in from Lamp. Non-qualified annuities are taxed at ordinary income, but that
Yes.
income doesn't count towards Medicare premium brackets, question mark.
So non-qualified annuities that have been annuitized generate an income that has a portion of it that is tax excluded. That portion that's tax excluded could be anywhere from 20 to 80%. To give a specific plug to a firm that is not helping people plan for health care, but has a perfect non-qualified annuity for this, is Lincoln's Income for Life. It's a non-qualified annuity. You do not have to annuitize the income after, I believe, a 5-year period. The income that's generated has an exclusion ratio of anywhere from 20 to 80%. You do not have to annuitize. Unfortunately, Lincoln has taken the stance of they are not going to help people plan for health care, so they are not marketing this annuity to get around Medicare's IRMAA.
Dan, we'll do one last question, and this is from Fred. Fred says, what is your website and contact information? Fred, I'll send that to, but I'll have Dan give it. And second question he asks, is there any private insurance alternative to enrolling in Medicare?
So website is jesterfinancial.com. Contact information is just D. McGrath, McGrath, at jesterfinancial.com. Unfortunately, there is no private health insurance company. What you can do is instead of signing up for Original Medicare, you can buy a Medicare Advantage plan. Medicare Advantage plans have to provide the exact same coverage of Original Medicare, Part A and Part B, but can also provide more coverage. We discussed that briefly. Unfortunately, in a Medicare Advantage plan, it does not take you away from Medicare's IRMAA. You're still going to be assessed these penalties. On top of that, if you still choose to not have health insurance, but you're receiving Social Security, they still will take the penalty they can directly out of your Social Security check. Hasn't happened to everyone, but it can happen. Unfortunately, there is no private insurance company in the competitive space of age 65 and older as a standalone. We're sort of all handcuffed into this world of Medicare. That's why we like to say that it's mandatory.
Dan, thank you so much, folks. You've been listening to Dan McGrath, our speaker today. There'll be a recording of this available to you, and then the email that will go out, there'll be Dan's information, how to contact him, and all of that. And Dan, I appreciate you speaking, and thank you. Our sponsor, Retirement Funding Solutions, is the nation's largest distributed retail reverse mortgage loan originator. And those who are listening, and you mentioned, and I appreciate that one of the ways that home equity is being used in retirement is simply converting it to a line of credit through a reverse mortgage. And that line of credit has a built-in guaranteed growth factor. Today it's growing at about 5.5%. So that means if your client has a $400,000 home and they're 62, 65 years of age, they may be able to get a line of credit of $170,000, $180,000 at age 62, and that grows. And that's another way for long-term care planning to have those dollars available to you down the road. And Dan, I appreciate you mentioning that. Jester Financial, Jester Financial.com is where you can get Dan, or Dan, what was your email again?
D. McGrath.
D. McGrath.
Yeah,
McGrath at
You got it.
jesterfinancial.com. So Dan, thanks so much. Those who are listening, we appreciate you. We'll talk to you next time. Bye for now.
Thanks, sir.